Greg.
Hey, how you doing, Polly?
Good, thanks. I'm excited about our interview today for our podcast, Totally Preventable. Our guest is Sarah Dinklage, the Chief Executive Officer for RISAS, Rhode Island Student Assistance Services.
I'm glad you said that because I would have completely messed that up. I'm horrible at acronyms.
RISAS has student assistance counselors in a lot of schools across Rhode Island. So I'm interested in talking to Sarah about how they're helpful in general to students, but with the pandemic and kids' mental health decline, how they've been more helpful and able to serve kids
right
in the past year or so.
I bet it's difficult. I don't do this. Well, I guess I should be asking is this at every school? I don't think every school has them, right?
I don't think every school has them. No. I think funding is difficult. But I could be wrong. Maybe there's been some push for them. I know Little Compton doesn't have one. So I know not every school has one, right. But I hope we're going to be pleasantly surprised at how many student assistance counselors are out there.
Yeah, I'd even be I'm pretty intrigued about the whole thing because again, we've never been through a pandemic before. We don't know what these kids are going through. So, just seeing the differences like between this and like a guidance counselor or, what, like you were saying, the mental health issues that are out there, trauma issues. I wonder, what it would take to get up every school, even private schools. I don't even know if they're in there either.
Right.
Well, it's going to be good to see. Let's pick her brain.
Yep. All right. So we can move right on to our interview.
All right, here we go.
Welcome everyone to our podcast, Totally Preventable. We're here today with Sarah Dinklage from Rhode Island Student Assistance Services. She's the Chief Executive Director? Officer. See, you should have done it. Welcome, Sarah. Thanks for joining us.
Thank you for having me.
So first off, can you explain what RISAS is to our listeners?
Yes, well, RISAS is Rhode Island Student Assistance Services, and we provide school and community-based alcohol, marijuana, and other drug use prevention, early intervention programs. We've been operating since 1986. We are funded by the Department of Behavioral Health, Developmental Disabilities and Hospitals, affectionately called BUDA, though I refuse to call it that. And we're also funded in part by Rhode Island school districts and various other grants that come our way. Our longest standing service, and what we're most known for, I suppose, is Project Success, which is a nationally recognized evidence-based student assistance program model, which works by embedding specially trained master's degree level student assistance counselors right in the school, providing teens easy access to free, comprehensive prevention services. And you asked what RISAS does, so I'm going to tell you what the student assistance counselors do. They provide, comprehensive prevention, multi-leveled. So to start, they provide universal prevention services, which are designed to reach the entire student body. And the goal of this is to really prevent substance use before it starts. So services that fall under that category include school-wide education, awareness raising, and outreach to the entire student population. But student assistance counselors also provide services that focus on kiddos at greater risk for use, including students who are living with substance abuse in their home, students who are starting to hang out with drug-using peers, children who lack the presence of a caring adult in their life. Those are just an example of risk factors that make a student more likely to turn to alcohol and other drugs. We provide services for those kids. We provide one-on-one counseling and group counseling. And we also provide assessment and brief one-on-one and group counseling for children who have already started using substances. The premise being that if we intervene early, we will prevent the progression to substance use disorder. So trying to, for kids who start using in middle school or high school, that's really early, places them at risk. And, by intervening and delaying that progression or eliminating it altogether, we're preventing substance use disorder. Those services are free, they're confidential, don't require insurance. And we also refer kids who need treatment and recovery support to resources whenever possible.
Nice. I feel like you covered a lot of our questions right in that
Yeah.
answer.
Sure.
Well, I also want to say, you didn't ask me this. You could ask me, like, how do you know this works? Well, it is an evidence-based model that has got national research results, project success. But in Rhode Island, the results from the 2020-21 Rhode Island Student Survey, we just learned this, demonstrated that students at schools with a student assistance counselor had lower past month marijuana use, lower past month alcohol use, 42% lower past month driving under the influence of marijuana, and fewer depressive symptoms than schools without a student assistance counselor. So we were, really pleased to hear that and to see that evidence.
Well, that leads me right to my next question. Are there student assistant counselors in every school?
Well, we're getting there, not yet, but we've come a long way. We began as a pilot. The first 4 high schools were established in 1987 as a pilot. And we're currently, as of today, in 70 middle and high schools across 33 districts. So that's just about every district. But there still are approximately 20 plus public schools without a student assistance counselor. But the state, our funder, BHDDH, is committed. It's part of their plan to establish student assistance in every middle and high school by 2025. So we are hopeful that one day that will be a possibility.
Is it because it's government funded that it's only public schools, or can you be in private schools as well?
I don't know that it's because of government funding if we would not be allowed to be in private schools. I think there's just a limit on funding. It's not infinite, as we all know. Yeah. So the focus has been on public schools. We do have a few charter schools that are interested if there is additional funding, and we have been talking about the possibility of going into those.
Terrific, especially with those great numbers that the Rhode Island Student Survey put up. Why wouldn't we want counselors in every school? Do you just work in schools, or do you have a clinic? Do you go to kids' homes, or is it just strictly school-based?
Well, the Project Success program is strictly school-based, prevention, early intervention. We do not provide home or outpatient treatment. Our counselors, however, are trained and have knowledge of community resources, and a key part of their job is to work to connect youth and their families to those services. Some of the other work that RISAS does, including our regional prevention coalitions, obviously don't work in a clinic, but they do work in the community.
Yeah, great.
So a big concern that I'm noticing, being a parent, is the decline in summer learning. Yeah. And do the student assistance counselors, do they work over the summer as well, or is when the school year ends, it ends? We
don't operate the Project Success program in the summer. It's strictly school-based. And we don't, just to highlight the summer learning loss, which I know is on everybody's concerns, we don't provide academic services to students. A lot of people think when we say student assistance counselors, they're providing academic support as well. They certainly work with kids who are failing academically, because we know that behavioral health, substance use, and mental health certainly interferes with one's ability to be academically successful. So they're working with those students, but not during the summer. what we do in the summer, as far as student assistance, is we do provide some youth leadership opportunities. For example, our youth-driven highway safety program holds its annual kickoff youth summit in August, where high school youth who've been selected and chosen and agreed to go develop action plans for the upcoming school year to address highway safety, including impaired and distracted driving. And we're also hopeful to bring back, we're in discussions now, the program Teen Institute, which is also a youth leadership program with a slightly different focus on kids who may not be the ones selected or chosen for some of the other youth leadership programs. So some of those students who are disenfranchised, not connected, don't get picked for anything. So we're hoping to do that, and that would occur during summer and school vacations.
Great, thank you. So what are the biggest challenges kids are facing? We hear a lot about the mental health challenges due to COVID. Is that what the counselors are seeing in the school?
Yes, we do certainly hear a lot about the children's behavioral health crisis, and the word crisis, epidemic is used nationally and locally. So, I'm asked that question a lot, how much of this is pandemic related? I think the pandemic certainly exacerbated the problem. But I also think children reflect the general mood and climate of the adults that they live with and go to school with. And adults are feeling stressed, overwhelmed, depressed. And this is so contagious. It's passed down to the children. We know that, again, things did get worse during the pandemic, but we're living in an age where there are, so many, world crises, national crises, economic, financial crises that, the whole mood and climate, not to mention mass shootings, the whole mood and climate is such that, adults are feeling it, and that passes down to children. I also like to say, we know that adolescence is a time for figuring out, who you are. And, during this time, when you're figuring that out, develop in normal adolescent development, peers play a crucial role. And, we also hear a lot about social media, but social media is where so much of our teens live. And so much is played out in platforms and areas that are not seen by adults. And, I can't minimize or overstate the huge amount of pressure that students, youth experience in social media. There's certainly lots of advantages and, ways that you can use social media for the good and to stay connected. But unfortunately, youth are bombarded 24/7 with images of who they are expected to be. And very few fit those expectations, but they think, the perception is that everyone else does fit those expectations. So everyone has more friends, everyone is thinner, prettier, having more fun, getting more likes than me. I've seen kids that constantly checking out, their Instagram, Twitter, and Snapchat, and, just to see how many likes they get from a post. And it's so much easier to be cruel when you're not face to face with someone. So cruelty is not new. Kids have always been in the past. They've been mean. Their bullying is age old. But what happens is kids get ostracized on a massive scale. So and very visibly. And there's no escape. So, where, if I had a bad day in school, going to school, or I had been teased or bullied, I could come home and sort of escape, to my room, talk to my parents, my sibling. Kids don't have that escape because the social media is constant, and they they are, in it, living in it constantly. And that's really the change that I see. It's not that, we have, more kids using substances, or more kids with mental health issues, or, more kids, getting into trouble, or, I don't think there was a time in the good old days when none of that existed. It certainly did exist. But the difference is with technology, it's, it puts a greater pressure on it, and less relief. Kids are not finding that relief.
Right. I definitely agree. So by listening to you, you're pretty much saying that the difference between this and, let's say, 10, 20 years ago has been the increased accessibility to technology, social media, internet.
Right.
Yeah.
I mean, I think back, you might have, when I was in school, ages ago, ancient history, you might, there might be some rumor going around about a student and in your class, or, of 20 kids. That is bad, a rumor going around, getting teased. But imagine that rumor going around 500, the whole school, 1,000 people. It's just, it's that shame and humiliation is often too much for kids to bear. And that's what I think are some of the greatest challenges.
Yeah. Yeah. Back, even, when I was in school as well, that rumor, you can hear the rumor, but it was really just the rumor. You didn't hear all the comments like you see.
Right, exactly.
Someone post something and the resharing and all that. And there was no picture to go along either. So I can definitely see how that's.
And it wasn't
affected.
in writing forever.
Exactly.
Once something more exciting came around, or it then left the chatting.
Exactly. Yeah. There's a term also used, a bullying term called shunning, and it's something that girls do far more frequently than boys, where they shun a particular other girl, and for whatever reason. And it's kind of subtle. It's not evident to adults in the school. You could say, why don't adults step in and prevent bullying? A lot of times they don't see it, especially with girls. They're all smiling. They all look pleasant. But behind this, what they're doing subtly is shunning, not letting someone sit with them at lunch. But again, that is one thing, and then it keeps going. It keeps going after school, and on the weekends, summer, and on a very visible platform.
Yeah, absolutely. I have had the pleasure to work with some super student assistance counselors. One in Tiverton, and then not work closely, but another one in Portsmouth. We attended the same meetings, and she was great. What do you look for in a student assistance counselor?
Well, we look for people who really love, and I use that word deliberately, love working with middle and high schoolers. You have to love that student. Sometimes we interview counselors who, have come from or agencies where they had sort of a mixed population, some adults, some little kids, some teens. I said, you have to love working with this age group because you're going to be working in a whole house full of them. We are looking for people who have the ability to engage those hard to reach kiddos who are using substances, because not everybody wants to work with that population. You have to want to work with that population. You have to respect them, and you have to have the ability to listen without judgment or lecturing. And you have to really understand, in order to help them change, if they're using substances, you have to understand from their perspective, what are the benefits of using? What's good about it for you? And, for example, it could be the first time that kid who was getting bullied feels now accepted, part of a peer group. That is so powerful. You know, they went to their party in the 8th grade. They've been bullied, prior. They, joined a group of students who are getting high, and all of a sudden now they're one of a group. So you have to understand that, and then you have to look at saying, helping that child, identify alternatives. And by alternatives, you don't say, stay away from parties, but you might say, who else in the school? Who else is there? And because despite the prevalence of substance use and mental health, most kids are not using substances at the middle, and particularly in middle school. But many, many students are not using at all. And you can help students identify that. That's really where social norms comes into play. That not everybody is doing
Yeah,
it.
that's admirable. Sometimes I feel a lot of adults who are there to help sometimes forget, how hard it is to fit in, especially when you're new in school, or you've been shunned and now you're trying to be out of that. I think that a lot of times we just want to help so much. We have that passion to help so much that we forget that, this youth is going through a lot, and to be accepted is a huge, huge thing.
That's right.
Yeah,
and you have to understand that and empathize with that. Or a student could be using substances to basically as a form of self-medication. Things are so bad at home. They may have family members who struggle with addiction that they're living with or being raised by, and, getting high or, drinking, is their way of just dealing with the situation. That in their minds, the benefit of using far outweighs the cost of using.
Right.
And those are the tough kids. But, when you ask about what do we look for in a student assistance counselor, we look for someone who can engage those kids and kids at all levels of the continuum. We want student assistance counselors to be a place where kids can go who are not using at all, who want to talk about either mental health challenges or how they're feeling, pressured, or just other issues, and all the way up though to the continuum of kids who are really in trouble with substances and mental health issues. And those are the kids we'll continue to be a support to them in school for as long as they're in the school. So student assistance counselors will follow kids from middle school to high school in a way, but they'll also for those students who are in trouble where the mental health challenges have escalated or become worse or are serious enough to get those kids into treatment and other resources. But it's great to have an in-school support. So just because they refer a student to treatment doesn't mean they can't see the student in school. They can still be that support in school.
Right. Now, you've mentioned the empathy. You mentioned the love that they have to have. So how do the counselors combat like the social norms of certain communities? Like when it comes to youth and it comes to mental health, how do they combat that?
It astounds me. I think we've come a long way. It astounds me that we still have some misconceptions and stigma around these issues, though we have come a long way. And that, you asked about the challenges, how they're different now. I would say some of the good things that are different than what they were when, certainly when I was growing up, is that, it is becoming, more and more okay not to be okay. That we have destigmatized, well, I can't say it's completely, it still is a stigma, but we are destigmatizing mental health and substance use disorders. And that's really important. So kids are feeling able to talk about it. Kids who don't fit in, kids who, are gender nonconforming, are, as I think we're all aware, are able to talk, to, it's more acceptable. We're not totally there yet for sure. But, that's all a change, that, kids are, and adults are being more accepted for who they are, regardless of sexual orientation, gender identity, and race and ethnic background. But so we've made great strides, but the way we can't ever let up. So it is so important to continue the public messaging, public health messaging. Provide training, for example, in the warning signs of suicide for everyone, and how to help a youth. And we've done a lot of that work as well. And I do have to commend the Regional Prevention Coalition Network in Rhode Island. The coalitions play a vital role in public health messaging in this area. And, we work closely with those partners.
Thank you. I know I hear mostly older adults, but still some younger adults saying, "Oh, kids today, they don't know what stress is. They've got it so easy."
Yeah.
Everyone's complaining about the poor kids and how stressed out they are. They don't know. Do you have some words of wisdom on what to say to those people that think that?
Well, I would just say, I would invite them to listen to a young person in their life. If they have any young people, it's easy to just kind of rail out on kids in the abstract, but, talk to somebody in your life, and, ask that child, that teen, what are you worried about? What are you stressed about? Are you stressed? Not every student is experiencing stress, but, if a young person says, "Oh, I'm not stressed," well, what are your peers worried about? What stresses them out? If someone is willing to listen, a young person will open up to them, if they know them. And I would just say, listen, and maybe educate about the pressures of social media and how that's different from when all of us grew up. But I think it's really being open to listening.
Now, can a counselor initiate services, or is this the student has to make the first step?
Anyone actually can refer or initiate. So a student assistance counselor in the school will take a referral from anybody. Parent could call up, the principal, the teacher, the nurse. It is often, particularly at the high school level, it is often that the student takes the first step. I would say over half of our referrals at the high school level are self-referrals or peer referrals, but which is a good thing, because that means we're really reaching students before everybody is aware that there might be a problem. So it's the student walking in. When a student does walk in, or is themselves, or is referred by someone, the student assistance counselor, if it's referred by somebody else, would call that student down at a convenient time, and do an assessment, over several sessions. If the student, it's all voluntary if the student comes back, but they're looking for substance use and mental health, family problems, they'll share with the student that someone was concerned about them, the reason somebody and what the referral person told them. Like they said, you used to be really great at math. Lately, you're just not turning in your assignments. You haven't been yourself lately. And, and then as far as the self-referrals, I would say, and you can imagine, seldom do kids walk into the student assistance counselor's office and say, "Ms. Dinklage, can you help me quit drinking? Can you help me stop getting high?" But they do come in because of relationship problems, mental health problems, complaining about a teacher, school-related problems. And the student assistance counselors are really trained to assess for substance use and substance use in the family on every student that gets referred. So that, and again, that's the early intervention piece. is reaching them early on.
So you, just to follow up on that, a couple parts of that question. Are the referrals anonymous? And I've asked that because of a peer referral. I know, a lot of kids don't want to tell on their friends, but if they're, like you said, a student won't come in and say, Miss Dinklage, I'm drinking. But if a peer comes in, my friend has really started drinking, I think it's becoming a problem. I know that friendship is still more strong than anything. So is that an anonymous thing, or do you have to tell who the person?
We'll be very, I don't want to use lenient isn't really the right word, but we when students make referrals of their friends, we will take that referral no matter what. But we will say to the friend, we will counsel that friend to, what are you afraid of? What are you afraid will happen if your friend finds out you tried to get them help? And also explain confidentiality, so that, you're not getting your friend in trouble. But we do not report back to the administration who's using substances. Now, if it's a life-threatening or there's, duty to protect, of course, we share that with students out in the open. If I'm concerned that someone's going to harm themselves, someone else, or they are using substances in a way that is, in a way that is dangerous, seriously dangerous, like, using, certainly using opioids, we would, all bets are off. But we do want to encourage kids to refer their friends. We're less forgiving of anonymous referrals from adults, because what happens is that we will do it in the beginning to a point, but it just leads to the focus being who told you, who gave you my you don't get anywhere. But I say to the teacher, nothing's gonna, so if the student gets mad because you referred them to the student assistance counselor, you said you care about them.
Right.
You reached out, you did the right thing. And I think and we work very carefully, and the school administrators understand this. We can't be seen as like a punishment. We do see kids who are caught using in school through a mandatory referral process, but that's about 10% of the referrals. So we do want those kids, because those are the kids who maybe won't voluntarily walk in. So we do want there to be a consequence of help. If a kid is caught, vaping in the bathroom, we're working with actually Tobacco Free Rhode Island around model school, policy for these, for kids who are caught using any substance. And, that's a good way to get those kids in for help, because they have to. It's an alternative to suspension, which we know doesn't work.
Right.
And you have to offer help when kids are caught, especially first time offenders, things like that. But for the most part, it's voluntary. And so no punishment if you don't go. Teacher could refer, they can't make the student go. The student doesn't want to.
Right.
So that's where, getting back to the quality of student assistance counselors, you have to have people who can really engage kids in the relationship. And we when we do interview, we do role plays, and we act out some of these scenarios, and you can tell. And you can tell. So we recognize nerves in job interviews, and sometimes.
I've seen some pretty creative ways that student assistance counselors have reached out to kids and try to engage kids, the whole student body, or they try to make it fun, and
You need to.
Yeah.
Definitely have to.
Right. Otherwise, why would I go see?
Right. Right. So Sarah, if some of our listeners are wanting to know more about RISAS, curious whether RISAS is in their kids' school,
Yes.
just looking, their district, wanting more information, where should they go?
Well, parents who want to know if there's a student assistance counselor in their school can go to our website, which is www.risas.org. And in the About Us section, there's a whole list of participating schools with the counselor's name. There may be some changes from now to, in the fall. Sometimes we have people move around to different schools, but for the most part, people are still in the same school. And the number, I'll give, the number is actually on the website. So the way to reach us is there. And I'd be happy, anyone can contact me.
Great.
And can schools contact you as well? Schools?
Absolutely.
Okay.
We'd like to hear from schools. We do hear from schools, but that is definitely how they can reach us.
And big funders that want to make sure that RISAS is funded.
Yes, that would be your legislator, the governor's office, the folks at PhD. When we interview people, they often ask about that. How stable is the funding? And I give them the same answer I said that was given to me 36 years ago, and I was interviewing for the job, and they said, "Well, the funding's not stable at all. It's not guaranteed. It goes year to year. No one's given me a 10-year contract or anything like that. It's like year to year." And all I can say is we're still here. So
we kind of feel the same way. It's kind of the answer we get here in prevention.
Yeah. Well, nothing is guaranteed in this world.
Right.
That's why I started out with nice dark hair, and that's why look what happened through because of the year-to-year funding.
I love it. I think it looks great.
Beautiful afro. Year-to-year funding.
Well, thank you so much, Sarah. This has been great. I learned a lot. I thought I knew a lot about RISAS, but I learned a lot.
Me as well.
It's my pleasure. My pleasure. Thank you for the work that you are doing.
Oh, thank you.
Very important.
Thank you.
We have an impressive prevention system in Rhode Island with infrastructure of the regional prevention coalitions and student assistance. And, many of us have watched it all grow up from the start. And wow, the work of the coalitions, very impressive.
Thank you. Thank you. Well, thanks again for joining us.
Okay, thank you.
Bye-bye, Sarah.
Bye.